beginning of this month, we had about 20,000 working hospital beds in New York City. What we have to do is convert as many as possible, potentially almost all of those traditional hospital beds into ICU beds. We have to make whole hospitals into intensive care units to get through these next weeks. That's how dire, that's how tough this situation is. If we're going to turn a hospital, I mean, think of Bellevue, think of NYU Langone. You go by these huge buildings, they're going to be all ICU if we can bring all the pieces together, the staff and the equipment and everything. Well, what happens to everyone else who doesn't need intensive care? We have to have hospitals for them too. What happens to people who've been infected with COVID-19 but are not at the point where they need intensive care, hopefully on the way to recovery? They need a hospital bed in many cases too, but we can't put them in an intensive care unit, which has to be reserved for those we're trying to save. So what the USNS Comfort allows, and Javits Center and so many other places being developed right now, is the ability to take all those other patients and give them care. And each location will be different, but it will allow us to keep a healthcare system going. Because of what's happened at Javits Center, we're going to have the ability to do that and save a lot of lives.
I applaud you guys, because you did an outrageous job here, really. God bless you for what you did. This place is going to save lives because of you. Thank you. God bless you.